Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A patient presents with marked weakness during resisted testing of right shoulder extension and medial rotation. Which of the following nerve lesions would most likely produce the described impairments? Option 1, thoracodorsal nerve. Option 2, suprascapular nerve. Option 3, spinal accessory nerve. Option 4, axillary nerve. Nerve lesions. A lesion of the nerve can occur through many mechanisms of injury. Possible etiologies include mechanical, for example, compression injury, crush, for example, fracture, compartment syndrome, laceration, for example, contact with sharp object, penetrating trauma, for example, stab wound, stretch, for example, traction injury, high velocity trauma, for example, motor vehicle accident, and cold, for example, frostbite. Peripheral nerve lesions may result in total loss of muscle over time. Recovery is based on the degree of injury and potential for regeneration of the nerve. Let's explore each of the options. Option 1, thoracodorsal nerve. The thoracodorsal nerve originates from the posterior cord of the brachial plexus and innervates the latissimus dorsi muscle. The latissimus dorsi extends, adducts, and medially rotates the shoulder and is a depressor of the scapula. Marked weakness to resisted shoulder extension and medial rotation is characteristic of a thoracodorsal nerve lesion. Option 2, suprascapular nerve. The suprascapular nerve originates from the trunks of the brachial plexus and innervates the supraspinatus and infraspinatus muscles. The supraspinatus abducts the shoulder, and the infraspinatus laterally rotates and horizontally abducts the shoulder. Pain is frequently worsened with cross-body adduction and internal rotation. Option 3, spinal accessory nerve. The spinal accessory nerve, cranial nerve 11, innervates the sternocleidomastoid and trapezius muscles. It's commonly tested with resisted shoulder shrugs. Due to the role of the upper and lower fibers of the trapezius as part of the force couple and upward rotation of the scapula, inability to abduct the shoulder beyond 90 degrees is characteristic of a lesion to the spinal accessory nerve. Option 4, axillary nerve. The axillary nerve originates from the posterior cord of the brachial plexus and innervates the deltoid and teres minor muscles. Marked weakness with abduction of the shoulder in neutral rotation and weakness in shoulder external rotation is characteristic of an axillary nerve lesion. The correct answer is option 1. Let's explore the all-student data. 63% of students selected option 1, thoracodorsal nerve, the correct response. 18% of students selected option 2, suprascapular nerve. 2% of students selected option 3, spinal accessory nerve. 17% of students selected option 4, axillary nerve. System classification. This question is a neuromuscular and nervous systems question, which represents approximately 24% of all exam items. Content outline classification. This question is a physical therapy examination question, which represents approximately 24% of all exam items. Level classification. This question is a level 1 question since the question requires students to possess basic foundational academic knowledge. Remediation of level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Academic focus area. Looking to review related academic content? Check out page 260 in PT Exam: The Complete Study Guide. Thanks for joining us on the Score Builder's question and answer video session. See you next week.